Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Hello, everyone. Hello, everyone. This is Dr. Thomas Grove. Dr. Marc Darrow's away from us here this week. This is Living Pain-Free. We're here to talk to you guys about your musculoskeletal orthopedic injuries and how maybe regenerative medicine might be an option for you. Remember, regenerative medicine is where we use injections to heal the body instead of using things like, pain medications or surgery or more invasive measures like that. I'd love to give you guys an opportunity to talk to us live here in the studio. We love talking to our people here. Our number to call us live, 866-870-5752. That's 866-870-5752. We want to give you a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Great place to start looking at how this stuff actually works. What's the science behind regenerative medicine? What are the studies behind this? We've got over 200 studies in that book. It's a new dawn. It's a new day here in regenerative medicine. We know now that we've got a great alternative option to surgery and these elective procedures, right? So if you're an individual who's got some aches or pains, maybe you had an MRI or an X-ray that says you got some arthritis, maybe you've got some disc bulges, maybe some small soft tissue damage, and you're considering things like surgery, regenerative medicine might be an option for you. We really want to make sure that we're available for you guys. We can have a free opportunity to get a consultation over the phone with our staff. That number to call us is 800-300-9300. Again, free consultation over the phone with our staff, 800-300-9300, and a fantastic resource for you guys to check out. We've got lots of great videos of us doing these procedures, lots of great studies and newsletter information. You can even watch our old broadcasts on the radio here. Our website to check it out, www.jointrehab.com. That's www.jointrehab.com. Tons of studies, lots of good videos of us doing these procedures. Take the fear out of what regenerative medicine really is. Again, commonly what we use is your body's own PRP, which is platelet-rich plasma. That's where we take your blood, like you're giving a blood test. We take that blood sample, we spin it down really fast in a machine called a centrifuge. That's going to concentrate down all those good growth factors, exosomes, platelets that are floating around in your body. And what we can do is take that, put it in a small syringe, use a small needle, and then using ultrasound guidance, we can actually aim exactly where we want to go with these cells, do injections, right? What to expect, a couple of pokes, and you walk into the clinic and you'll walk out. The beauty of what we do, the complication rate isn't quite the same as surgery, right? We're not using general anesthesia. We're not worried about significant downtime. Again, you're immediately walking out of the clinic. So it's a fantastic resource that we have available to ourselves today. And again, the studies keep coming out week and week, looking at how we can use the body's healing cells to actually get some healing going, right? So when you're looking at things like orthopedic injuries, you go to your primary through insurance. What are they going to offer you? Typically, maybe some NSAIDs. Those are non-steroidal anti-inflammatory drugs, right? Maybe some ibuprofen, meloxicam, Motrin, Aleve, these sort of medications. Again, relatively inexpensive. The downside is we know that these medications are not great for tissue healing. So they're anti-inflammatory in nature, which typically results in people having less pain. So people kind of get tricked into thinking, oh, well, if I have less pain, I must be healing. But again, just give this a Google. Same thing with steroid injections, right? Things like Kenalog, You can use these as tools certainly to decrease people's pain, but look up things like chondrotoxicity and NSAID use, or lidocaine. That's another one, numbing medication that we know that actually kind of deteriorates or breaks down that cartilage. Again, steroids are notorious now. We get so many great studies in that. Again, can be useful for pain control, but it's temporary. It's a classic example of someone comes in, maybe you got some arthritis. They give you a steroid shot and you feel better. Maybe it's a day, maybe it's a week, maybe it's a month or more. But that pain inevitably comes back. It's a great model for surgery because now we're wearing down more of that cartilage, and we know now, especially repeat injections of these substances can do a lot of damage now to the joints. So a lot of times you're kind of lulled into sleep thinking, oh, well, my pain's controlled. Meanwhile, you're doing more damage and you're setting yourself up to have that sort of surgery. So we'd much rather use the healing cells of the body. So we already talked about PRP. Another one's going to be stem cells. Very, very powerful healing cells of our body. We've got them all over the place. The old school procedures, you can actually take some from your fat. We like to go for the bone marrow. So we do something called a bone marrow aspiration. Really good source of these healing cells. What we do there, we give you a little numbing, right? Numb up the back of the pelvis, go in with a small needle, extract some of that bone marrow. It's got, both platelets and stem cells and a lot of good growth factors there. So again, minimally invasive. And what we can do is take those cells and put them directly where we want to go. I got some additional training here this week on our ultrasound machine. It's so crazy how good the technology is, even compared to 15 years ago. How far ultrasounds come. So I talk about it every week, but this is a tool that I use to actually look at the tissue. So different than maybe like an ultrasound that you'd get maybe like at your physical therapist, which sort of heats the tissue up. This uses ultrasound waves that goes through a probe, very fancy technology, little crystals in there. They put off these ultrasound waves, and then they hit tissue, and they get bounced back to the probe, and then that gets translated into an image that I see on the screen. And it's dynamic, meaning I can put that probe directly on tissue that I'm interested in and see how it moves, right? If I'm looking for something like a tear, and I put some force through that area, all right, through a dynamic evaluation, we're both looking at the screen together. We can actually see that soft tissue. Caught something called an MCL tear this week. That's a medial collateral ligament. So if someone has pain, on the inside part of their knees, there could be a lot of things going on there, right? A lot of muscles and tendons and ligaments that cross that joint. This is a great example where they had some knee pain. They had a little arthritis, but their main pain generator was that MCL. So how do we figure that stuff out, right? Back to basics. If you come in the clinic and you're complaining of some discomfort or pain, maybe some aches that are going on, first thing I'm doing is I'm putting hands on you. I want to make sure that we're doing a proper physical exam and trying to maybe reproduce those symptoms and pinpoint right where that pain's coming from. So this is somebody who had an x-ray. They came in, they said, man, I got some pretty bad arthritis. They're going through a couple of local orthopedic surgery consultations, seeing exactly what sort of joint replacement that they're looking at. And they actually heard about us on the radio, which is really fun. It's always exciting when I get to connect with people from doing this show. And they're like, you know what? I got a sneaking suspicion. I just want to get another opinion, which I always encourage patients to do. Man, when you're looking at something like a big orthopedic surgery that's elective, right? We have to think about those complication rates, things like anesthesia. Some people, unfortunately, just don't wake up from anesthesia. Or if they do, months and months of brain fog, those sort of things, lots of complications with those strong medications potentially. Things like blood clots. You could also have just chronic pain as a result of the surgery. Maybe on accident, maybe they hit some nerves, maybe they hit some vessels, things like that. Again, not saying that everybody has a bad experience with surgery. Certainly not. We respect the heck out of our surgical colleagues. Very impressive. The training is grueling. I did a lot of orthopedic surgery, a lot of assisting certainly in my training, thousands and thousands of hours. Man, these guys they're awesome at what they do. It's just the nature of these surgeries. A lot of the times are going to come with their own complications. It's a tall order to go in and cut tissue and put in artificial joints and things like that, and not have complications. So, we all have our own biases. I'm biased to be more conservative first. I'm certainly not against surgery when it's needed. big car accident, big trauma, you get a big broken bone, things like that. Certainly, don't mess around with that. Get that surgically treated. But with the elective procedures now, those are the procedures that the patient, you, gets to choose to see if you actually want to do it, right? So it's not an emergency situation, but you have some pain, and there are surgical options to address that. And again, a lot of times when you're looking at the success of surgery, it's more based on like the image or the picture, right? So if I have somebody with, maybe a degenerative disc or someone with arthritis, and you look at the pre and post pictures, maybe on an x-ray or a CT or an MRI, and after you have an invasive surgery, certainly it's going to look different, right? But really what we're interested in is, what's your pain level? What's your functionality of that joint? And again, what we found here nowadays is these regenerative medicine treatments are a real option for people. So getting back to the example of someone with knee pain, had the arthritis, certainly reasonable to think that's, the source of somebody's pain. But when you do a physical exam and I stress out that ligament, that is exactly the same pain that they were experiencing. And then when I put the ultrasound on, same thing. The MCL is actually a fun little piece of anatomy. There's multiple bands of it. There's one that's kind of closer towards the skin. There's one that's a little bit deeper underneath. And so I can actually look at those different bands with the ultrasound. Again, higher definition than MRI. People are really, really surprised every time I come in. They think, oh, it's just going to be this blurry image, what the heck that we're looking at. But, their eyes kind of light up and they can actually see, especially if something like this, a tear on ultrasound, pretty easy to spot once you have some training in it. When it's like kind of guide them through what I'm looking at, the light bulb kind of goes off. They're like, oh my gosh, I can't believe I was going to have a surgery for something like this, because that wouldn't address their core issue, right? If you've got a ligament issue and you're replacing a joint, and that's just an unnecessary surgery. So very important that you're getting a proper hands-on physical exam. We're not solely basing, our care plan off of what somebody's image is. Again, I'm a big fan of ultrasound. The technology's come a long way. And the scope of, how we've got so many different options in terms of imaging nowadays. It's non-radiating. We don't have to worry about any sort of radiating energy compared to something like a CT or an X-ray. So non-radiating energy, it's dynamic, so I can move that tissue around and find a lot of things that are missed on an MRI, which again, static image, sometimes you don't get a great quality image. And you have to remember when you're looking at how radiologists read an image, anything that doesn't look completely normal, they're going to comment on, which can be kind of a frustrating experience. I find myself every day playing translator. So someone comes in with their MRI results, and they're trying to read it, and they're like, what the heck does all this stuff mean? So that's, the fun part of my job is being an educator and laying out exactly, what the radiologist is seeing. I'm very, very blessed to have awesome training. Actually, in my fellowship, we had to shoot all of our own images for our patients. So you get good at, setting patients up, and you appreciate if you've got kind of a bad angle, how bad something can look versus a properly aligned image. But that's when I really, really learned that ultrasound is an amazing tool because when you compare what you see on a static image versus a dynamic image, you can get a lot more information. And the whole idea that we're trying to get across to our patients is we want to be specific where we want to actually treat somebody's issues. We don't want to just guess, right? So if I've got somebody who's got some pain, I really want to be confident in terms of what do I think that's coming from before I, make a recommendation whether or not we should maybe proceed with surgery. Maybe we could just do something like give it some rest, right? Again, the role that we're playing is trying to speed up that healing process that the body naturally is already going to do. It's a very complicated process in general because it's a lot of cell-to-cell communication. It's a really fascinating set of steps that go on after you do an injection. So again, layman's terms, you inject these healing cells in the body. They create an inflammatory response. So again, really the only side effect that we're expecting patients to have is maybe a little stiffness, maybe a little soreness. That's just that inflammatory response that's happening. So that's what actually jumpstarts that healing process. From there, it's a lot of cell-to-cell communication. There's a lot of things that are involved to try to bring in growth factors. We know that after you do an injection, you actually wake up your body's own sleeping or nascent stem cells. Again, we've got this stuff all over our body, and it's a very coordinated, effort to actually get some tissue healing going on. And again, that all sounds great, but what are the actual results of this stuff, right? When you're looking at the studies that are coming out now, we got good longitudinal studies looking at, okay, we do an injection. Let's follow up with you, right? After a month, 6 months, a year or more. Because a lot of times things like steroids, you might get, like I said, tricked into thinking I'm getting some healing. Because if you just follow up after, a week or a month, certainly you might feel a little better with that steroid. Maybe it's still active in your system. Maybe it's still, fighting off some of that inflammation. from your pain generator. But really what we're interested in is long term. So we know now that especially in things like joints, if we put some of these regenerative cells, right, PRP, platelet-rich plasma, or stem cells, it does a couple of things. So when you're looking at something like arthritis, there's a couple of things that can cause pain for people. So when you're looking at an image, you might see joint space narrowing. That's a classic finding. That just says, hey, we've got a little cartilage that's getting worn down, right? Cartilage is that tissue that allows bones to glide smoothly over one another. So people who have like truly bad arthritis and, bone on bone arthritis, that's end stage. It's like two bricks rubbing together. It's really crunchy and causes a lot of discomfort for people. We also know now that a lot of this osteoarthritis is mediated by chronic inflammatory proteins and cytokines. These are kind of the bad guys, right? These are things that can cause chronic inflammation of the lining of the joint, called the synovium, which can cause a lot of irritation as well. So we've got a combination of things that cause pain. And so after we do things like PRP and stem cells, we're looking at great studies showing we can actually grow a little bit of cartilage there. We can actually slow down the wearing down of that cartilage. When you actually look at we call it the cellular milieu, right? What's all that stuff floating around in your joints? Pre and post treatment, we see a huge decrease in those chronic inflammatory proteins and cytokines. So again, long term, it's a much, much better option for you because we know we're actually healing the body, right? So to be very, very basic, we take the healing cells of the body and we're just hijacking that system. We're taking a concentrated dose, right? A supraphysiological dose, right? More than we normally have in that area. Put it in a syringe, inject it locally. Again, using ultrasound guidance, being very specific where we want to deliver those cells on target. And we get some healing going. Let me give you guys an opportunity to talk to us live about your injuries. If you or a loved one has some pain, some aches, maybe you have something going on with your musculoskeletal system, give us a call. We'd love to talk to you live here in the studio. Our number to call, 866-870-5752. That's 866-870-5752. Want to give you a copy of our book for free. We'll even pay the postage for you. Title of that book is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Great title of that book. Again, we'd rather regenerate and heal up that tissue rather than going underneath the knife and subjecting yourself to the complication risk of surgery. Again, this could be a real option for you. Nowadays, again, these elective procedures don't always have to result in surgery. Maybe we can get some cells in there, get some healing going for you. In terms of a consultation, we give that for free over the phone with our office staff. Give us a call. The number to call, 800-300-9300. Number to call us for a free consultation over the phone with our staff, 800-300-9300. 9300. If you want to actually see us do these procedures, right? Take the fear out of this stuff. You can actually watch people that no one's jumping off the table, right? These are pretty quick procedures, very small needles that we use. Again, very fun to see. You can actually watch that needle going in yourself using the ultrasound. Again, the screen is right in front of you. More studies as well, hundreds of studies that you can check out on our website, www.jointrehab.com. That's www.jointrehab.com. There's a spot on every page to shoot us an email. We make ourselves very available. Your loved one has some issues and you want to get some information, again, spot on every page, shoot us an email. We answer emails every single day. I'm looking at one here today. This would be an interesting one to discuss here. A couple days ago, looks like. I've got 3 epidurals for my neck. The last one did not work. My pain is increased, wakes me up at night, and I have difficulty sleeping. Now it seems like my joints ache. I'm active, and I feel you may be able to help me. So it's a very common email that we'll get. So yeah, let's talk about that for a moment here. So someone with neck pain, maybe they've got some epidurals, right? That's going to be where you go into the epidural space. That's going to be something that might address maybe some true nerve pain. So if someone has an epidural, don't really get a whole lot of results, I'm thinking, probably not coming from the nerves. And again, the reason that, again, I'm just speculating here, that they probably had that done is they had maybe some imaging that showed maybe a little pinching of a nerve, maybe a little stenosis or narrowing down, maybe where that spinal cord is. These are very, very common findings that we see on routine imaging. I reference them pretty frequently, but when you're looking at people with no, neck or back pain, and you're doing imaging on these people, we've got good studies showing that a majority of these people are actually going to have these issues on imaging with no pain whatsoever. So I don't get super excited when I see things on imaging like that. I want to make sure I'm correlating that with what your actual symptoms are. So if I do a hands-on physical exam, and I try to maybe stress on some of those nerves and I'm not reproducing those symptoms, I don't think that's the cause of somebody's issues. And especially if you've had some epidurals with no relief. Again, if I had to put my money on it, most likely more of a ligament issue. It's a very, very common area of pain for people. I had a lot of neck patients here this week, but if you had maybe a fall or if you had a trauma to that neck, maybe a whiplash sort of injury, we can sprain ligaments in our neck. I don't know if you've ever taken a funny step off of a curb, maybe twisted your ankle. That's the same idea, right? It's the same type of tissue that's located all over our body. A ligament is a piece of tissue that connects a bone to another bone. And so this is a very common finding, very easy to tease that on a physical exam. And so this is somebody I think that could potentially get a really good response to regenerative medicine if that's what's going on. But these are very common circumstances where, the traditional model is you get an image, you see something wrong, maybe you do some oral pain medications, right? There's a lot of different medications out there for nerve pain, and you don't get better. Maybe they say, well, we should go the injection route. What's covered by insurance, right? Steroid shots, things like epidurals, and you still don't get results. What's the next step, right? Either you're going to do more injections or you go to surgery, right? So if you've got an issue that, is not being addressed properly, surgery might not be the best idea for you, especially things like ligament issues. It's pretty rare for anybody to actually comment on a ligament for the radiology read, unless, of course, you have a really big tear. The ligaments that we have that line the entire spine, man, they are really, really tough. I did a lot of treating, a lot of teaching residents and fellows and medical students in cadaver labs. That's where you take bodies and you do dissections, you teach anatomy, you teach different, injection techniques. And when you're actually looking at this tissue, man, those ligaments are really, really tough. So it's not super common to tear something like that, but man, you can certainly sprain it. That can be something that causes a lot of discomfort or pain for somebody. And depending on the location, you might have other symptoms going on too. If you've got something going on maybe with a facet as well, that's a little joint where the backbones glide over one another. They're very small. You can get things called referred pain patterns. So someone might have pain, up into their head or, into their back. That might certainly be coming from an issue with the anatomy going on with the neck. That's why it's super, super important that you're doing a hands-on physical exam. And again, the reason we're so passionate about this stuff is we see these failed surgeries. We see people who've had, things like laminectomies or things like fusions in their neck, which are pretty big surgeries, right? Complication rate isn't great for those. But really what we're looking at is the long-term effects of something like that. It totally changes, the biomechanics or how force is distributed through that spine. So especially if you're immobilizing or kind of getting a segment of that spine more stuck from having a fusion, your body's ability to move is, forever changed. If you see somebody with a really, big fusion, they're really, really stiff, right? They're unable to really move a whole lot. That's something that can cause a lot more strain above and below that level where you had your surgery. So anytime people have fusions, I always just, lay out the options for them and ask them, well, did your surgeon talk about, inevitably what's going to happen with the segment above and below where you had that surgery? And what ends up happening is typically you get a lot more force through it. Things wear out faster. Maybe you get more arthritis. So then you get talked into another surgery and then another surgery. And we see these patients every single week. It breaks your heart when you're seeing people who are in chronic pain. And then you put hands on them and you find that the pain is actually not coming from that surgical area. It's from maybe a superficial ligament that could have been addressed with regenerative medicine. It's something that really, really is tough. And so that's why we're so passionate about that. And we do things like this show, and we take time with our patients to lay out what their options are. We want to make sure that you're feeling good, about your medical care, making sure that you're understanding what the actual risks are. What does that recovery time look like for you? Unfortunately, our system through insurance doesn't always lay out what all the options are. Again, we live in the world where regenerative medicine isn't, one of the first line treatments for things, unfortunately. So when you're looking at things like injuries, if we can regenerate and heal that tissue, man, it's such a better option. We're not looking at things like chronic pain medications or the complications from surgery. It's a much, much better option. You can like to use PRP or platelet-rich plasma, or maybe stem cells that we can get from the bone marrow. Really fantastic set of skills that we have in front of us now with ultrasound. We can be very specific where we guide that needle, use very small needles, certainly, which makes the procedure much more comfortable for the patient. But, when you're facing things like a surgery, not going to hurt anything. Get another, consultation. And I'd recommend, too, try to get something that's maybe not surgical in terms of your consultation. If you go to 10 orthopedic surgeries, good chance they're going to want to do surgery on you. So certainly we are in the non-operative sports medicine world. So just get an opinion, see if maybe something else that's less invasive is a real option for you. That way we can avoid, hopefully, you going underneath the knife. So coming up to the break here, guys, again, want to give you an opportunity to call us live in the studio. Our number to call, 866-870-5752, 866-870-5752. Free consultation with our staff over the phone. They're waiting by now, 800-300-9300. That's 800-300-9300. Also, check out our website, www.jointrehab.com. That's www.jointrehab.com. See you shortly.
You're listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment. Stay tuned.